All right. First things first, just like anything, I want to give a disclaimer that with everything going on in Medicare, this is really for educational purposes. I'm talking to people in several different states. So all this information I'm trying to keep general, enough that people get benefit from it. I'm not licensed in every single state and I'm not contracted with every single carrier. So, if you want to talk about your individual situation, you're welcome to, at the end of the slideshow, book an appointment with me and we'll go from there. Okay. So just a little agenda. First, I'm just going to do a real basics on Medicare. If everyone here is on Medicare, this is probably something we've probably talked about in the past. I'm also going to talk about what Medicare costs. They have started to give us some idea of what is not just changing as far as the insurance companies next year, but what's happening as far as Medicare premiums and IRMAA and whatnot. Also, we're going to talk about what's actually really going on right now in the Medicare space. There's been quite a bit of disruption, not just this year, but last year as well. Grass isn't always greener, so if your plan isn't ending, just spoiler alert, there's a very good chance that if your plan isn't ending, my recommendation is going to be the grass isn't greener because there isn't one company that has held their plans same as they were before. So we'll get into that. And then everyone should have, if you're already on a plan, you should have received an ANOC, and an annual notice of change letter. So we'll go through how to read those and what to look for. And then I'll talk about what I can do for you. All right, so let's get started. So in 2025, the Part A, so everybody should, if you're on Medicare, you should have received one of these red, white, and blue cards. Okay. Um, Medicare normally starts, oops, Medicare normally starts when you turn 65, but you could delay it if you have group coverage for one reason or another. So the gateway to any type of plan is having Medicare A and B. Medicare Part A covers your hospitals. Um, and then the Part A deductible is 1676 as of 2025, and the 2026 number has not been announced yet. And anything that happens outpatient, like a doctor's office visit or whatnot, is covered under Medicare Part B. Medicare Part A, if you've qualified for Medicare, you should be getting Medicare Part A at no cost to you. Medicare Part B, however, has a premium attached to it. You pay out of your Social Security if you're on Social Security, or you get a quarterly bill from the Social Security office to pay your Medicare Part B premium. All right. Medicare Part B has a $257 deductible, and as far as I can tell, it looks like the deductible is going to be going up to $288 per year in 2026. To backtrack to the Part A deductible, that's not an annual deductible, that's per incident. So if you go in the hospital in January, then back in November, you're going to pay that deductible more than once. All right. On top of the deductible, the Part B coinsurance is 20%. A very important thing to think about is 20% of things that happen outpatient, it could add up very, very quickly. And there's no out-of-pocket maximum. So let's say you're getting, lots and lots of specialist visits. If you're getting, annual, physical therapy, even treatments that might happen at the hospital, if it's billed under Part B, there's no out-of-pocket maximum. So that brings us to what we add to Medicare A and B. There's really two almost opposite types of plans, and really which type of plan is right for you is based on your individual situation. All right. Option one is something that's pretty easy to understand. It's a Medicare Supplement insurance. It's also called Medigap plans. And the idea is this is going to fill those gaps of Medicare. Now, if you've been on Medicare long enough, you can buy a Medicare Supplement Plan F that covers 100% of the Part A deductible, Part B deductible, the 20% excess charges. They have not been allowing new Medicare members to join that for the past couple of years. The next best plan is a Plan G, which covers the Part A deductible and the 20%, but it doesn't cover the Part B deductible. Okay. These have an associated premium, and depending where you are, anywhere between two and $300 is what I'm seeing in the Northeast, and maybe a little bit less if you live in other parts of the country. So you have all the gaps of Medicare covered. And the great thing about these plans and reason why people gravitate towards these is there are not any networks. First, the doctor's office or the hospital bills Medicare. So assuming the doctor's office or hospital participates in Medicare, the balance of the bill gets billed to the insurance company. So you don't have to worry if the hospital takes Medicare, you can go to any hospital in the country that takes Medicare and have your bill paid 100%. All right. The negative to these plans is the associated premiums. And on top of that, you also have to add a Medicare prescription drug plan to it. And these used to be a lot less expensive. In the past couple of years, they've gone up in price significantly. I'm finding most plans are, let's call it an average of $50. All right. So, I'm seeing a lot of plans that have the drugs that my clients need are costing almost $100 a month. So just to keep numbers easy on me, I'm going to use averages. Let's say the Medicare Supplement plan costs $250 and the Medicare Part D costs $50. So you're paying $300 a month to be on the side of the page. The reason you do it again is no networks, no copays. All right. So if you start the year knowing that your out-of-pocket cost is going to be $3,600, and the only way it would go up is by the Part B deductible and then your prescription drug copays. So let's budget on this side almost $4,000. $300 times 12 months is $3,600 plus the Part B deductible. So you're almost at $4,000 a year per person on the side of the page. On the other side of the page, we have plans called Medicare Advantage or Medicare Part C. And if you turn on the TV right now and flip to any station and wait till the commercial break, you're going to see commercials for these. I just got a phone call from somebody yesterday saying, "Hey, what's this plan I just saw on TV?" And he called the 1-800 number before he called me, and he was frustrated. He's like, "Well," I was like, "Well, they're offering plans. It's a national commercial. They're offering a plan that's not available to you in Connecticut." Um, Medicare Part C plans, Medicare Advantage plans, it's a package plan where now you're insured by an insurance company as primary. These are subsidized by the government. So they take that magic bag of money that they've been setting aside for the past 40 years of your lives. They've got some vault in, theoretically, I'm making a joke of this, in Washington, D.C. with your name on it. So that's what's paying for that bag of money is what's been paying for your Medicare insurance. Since now you're insured by an insurance company, they're sending money from that Medicare fund to the insurance company to subsidize your Medicare Advantage plan. All right. A lot of these plans historically have been zero premium. So you're only paying for your Medicare Part B premium, whether it's $185 this year. You pay in that $185 and then and then you're not paying anything for what's on top of that. All right. These combine everything your A and your B covered, plus your Part D, and many plans offer extra benefits. These extra benefits are one of the things that have been impacted quite a bit this year. It started to happen last year, but this year it's been impacted quite a bit. They offer dental, vision, hearing, gym memberships, over-the-counter supplies. A couple years ago, they were even offering things like Apple Watches, golf green fees, and it was amazing all those things they were giving away back then. And a lot of that stuff started to go away last year, and many of these benefits have been greatly reduced this year. Okay. So the positives on this side are you have, you have a much lower expected premium. The negative is you'll have to start dealing with networks. You'll have to start telling me who all your doctors are, what hospitals you'd go to, and making sure that the insurance company covers those places. If you buy a HMO, there's two types of Advantage plans available in most areas, an HMO or a PPO. An HMO is a closed network. So I used to, when I was doing these things in person, I'd walk around in my car, back of my car, I'd have a bunch of kits for every company. And then they each would have this thick book about like this, where it would be, here's a list of all the doctors that are covered. On an HMO, if you're not in that thick book, you don't have coverage at that doctor's office. Another thing is the HMOs have is referrals. The insurance companies want your primary care doctor to be a gateway, if you will, almost like a guardian to the specialists. So if you have to go see a specialist, you have to go to your primary care doctor first, have to have a conversation with you, and then they have to refer you to a couple specific doctors. People hate this. I mean, I don't know if anyone here has an HMO and they've dealt with that, but it's one of the biggest complaints ever been getting. I've always in the past recommended PPOs for two reasons. Number one, you don't have to deal with referrals, and number two, you don't have to worry about that closed book, because if you have to go to a doctor or a hospital that's not contracted, you can still go. You just pay more to go see that person. So if you have a choice in saying, hey, the number one specialist for what I have going on is not in my insurance company's network, go ahead. Just be willing to pay a little bit extra, but you are covered. All right. So that's really the summation of it, where if you pick an Advantage plan, you could save quite a bit of money. If you're relatively healthy and you have a year where you're not in the hospital and you're paying zero premium for that plan, I'm going to talk my hands now. So zero premium for the Advantage plan versus we talked about $4,000 a year. You add up the 20s, 50s, hundreds, 500s even now, for a hospital copay. On a typical year, would you reach $4,000 in copays for what you have going on? Most likely not, unless you have a couple extended hospital stays or something major going on. And on the Advantage plan, if you go past that, they all have out-of-pocket maximums. Right now, those out-of-pocket maximums might be $6,000 or $7,000, and it might be going up next year. But I'm seeing most plans still in the between $6,000 and $10,000 out-of-pocket maximum range. So insurance, if you think about it, is you're transferring risk to an insurance company. All right. So on the supplement side, you're really not transferring much risk. You're paying for them to pay your bills. On the Advantage side, if you have a healthy year, you've saved potentially $3,000 or $4,000 in costs. And if you have a really bad year, you might have made a mistake where, on the supplement side, you could have gotten out of the year for $3,000. You may end up having a year where it costs you $7,000. So some people like the idea that, hey, all my doctors, my hospitals I go to are in the Advantage network. I'm relatively healthy. I'm gonna take the risk that I save some money that year, and then add on some extra benefits like the vision, dental, hearing, and those are extra benefits that they might get some value out of. Okay, so reasons why people would pick an Advantage plan still, even though dental's the biggest issue. I'm having trouble finding any plan that covers dental of any significance. But you still have a great hearing benefit. So if you need a hearing aid, Medicare Advantage plan, you have a copay for a hearing aid, where on the supplement side, you end up being paying out of pocket, maybe $3,000, $4,000, $5,000, $6,000 for a hearing aid. So the other reason why you might pick an Advantage plan might be you are healthy enough that you expect your copays on in a year to be low and your doctors accept it. So there's pros and cons to each plan. If you are looking to switch from one side to the other, this is the time of year to do it. Now let's talk about some of the costs. IRMAA is an extra cost that you would pay if you're earning more than, and I'll go through the brackets and show you what the costs are, but it's income-related monthly adjustment amount. So most people pay the base premium for Medicare, but the government takes a look at your tax return, your modified adjusted gross income from 2 years prior. So for next year, they're recalculate using 2024 tax returns to recalculate what you'll pay for your Medicare Part B insurance. Now, if you retired in 2025 and you expect your 2026 income to be significantly lower than 2024, there's a simple form that we can fill out to reduce your IRMAA. All right. This is a very key number because if you even go over by $1, you're stuck in that bracket for an entire year. So, these numbers are ones that we want to take a look at. If you're doing if you have a financial advisor, they should be looking at these numbers for you. All right. So for a single person, less than 109,000. For a married couple, it's $218,000. You'll be paying what's projected to be the base rate for Medicare Part B of 206.50. This hasn't officially been announced, but everything I'm reading, once the government gets back to work from the shutdown, that's what they're looking to announce. And then you'll notice other brackets between 109 and 137, you start paying an extra surcharge. So your total premium would be 289. Between 240, 274 and 342, you pay 413. And between 342 and 410, it's 536. All right. And then this chart, it got cut off. I'm not sure why, but so and they do the same thing for Medicare Part D. So, this is cut off, and if anyone falls in these brackets, just shoot me an email. I can get you the exact numbers. But for your prescription drug plan, they add another surcharge to it. It's roughly $50, and it goes up from there after the first bracket. People say, what if I have a Medicare Part C where I'm not paying anything? The Part D is included in my Part C. Even if you have a zero premium Part C plan, they add the IRMAA to your cost. Okay. All right. So what's going on in 2026? Let's go back to 2025. If you remember, the Inflation Reduction Act added a cap on prescription drugs of $2,000. That's going up to $2,100. So if you're taking specialty drugs, so the government said, if you want to offer Medicare insurance to the community, you need to put some of these provisions into your plans. $2,000 maximum, and there's certain drugs, high-cost drugs, that may have not been covered before that the government imposed that these insurance companies have to cover. And this is, in my opinion, one of the big reasons why these plans is blowing up is maybe a bad way to describe it, but the reason why these benefits have gotten much, much harder for these insurance companies to provide is, I think, that if you have a beneficiary that's taking a drug that's $10,000 a month, the insurance company has to cover it, and then the person pays $2,000 for a year, the loss ratios of these insurance companies has been humongous. Some things that's not different. There's no deductible on insulin, $35 a month. That's another thing they added, which is quite a nice benefit if you are a diabetic. Vaccines are still free. A lot of the plans are adding deductibles to their prescription drug benefit. So you'll notice a lot of times it was no deductible on tier 1 and 2 drugs, and then tier 3, 4, and 5 drugs, you might have had a deductible. That deductible is up to over $600 on some plans. So some people might be shocked in January and February, why are my drugs so expensive? Well, it's because there's a deductible on the prescription drug plan now. One of the things I led with is the grass is not always greener. All the insurance companies got affected by this. Some of them went as far, and I'll actually name them. United Healthcare and Tufts, their PPOs in the Northeast got pulled off the market. So everyone on one of those plans, and there's a couple other companies that did it, but those are the companies I use primarily. So if you're one of my clients on one of those plans, you've probably already gotten an email from me letting you know this and saying, let's start shopping for a new plan. If you didn't get that email from me, or you didn't get a notification from your insurance company that your plan is ending, I'm warning you that the grass isn't always greener. As I'm researching plans for next year, I haven't found one plan that hasn't been extremely negatively affected as far as what you're paying for deductibles and co-pays and ancillary benefits. Fortunately, in Connecticut, Massachusetts, we're guaranteed issue states. So if you wanted to go from the Advantage side to the supplement side and not have to deal with networks and copays anymore, this is the time of year to do it. If you're in 46 other states other than these two, I think it's Minnesota and New York are the other two states, um, you're going to have to answer some medical questions to go from Advantage to supplement. All right. So we're lucky. Most of the people in my business are lucky that we have that. Um, if your plan includes all your doctors and all your drugs, and to switch over to get an extra, $20 in over-the-counter supplies, or if we can shop with different stuff. If you want to save a little bit of money on a deductible here or there or a copay here or there, you may be able to do that, but there's no plans out there that are really, in my opinion, standing out. So really, right now we're going to be shopping for networks, um, making sure that your networks are still strong, and other plans, outside might have trade-offs. So each company is finding a different way to price this. Last year, United Healthcare got rid of their dental. This year, almost every other company is following. Um, so if you are on a plan that is renewing and you're unhappy with it, send me a list of your doctors and I can tell you what's available in the area. All right. So United Healthcare was a little bit late sending them out, but most companies send this out, mid-September and end of September. United Healthcare didn't send those out until beginning of October this year. So you have an annual notice of change. The big thing you want to look for is whether your plan's ending or not. They should, and they have a very nice way of saying it. They call this a service area reduction. So this is the key thing you want to look at is if it says service area reduction, that means your plan's ending. And that's when you need to get shopping. All right. But this annual notice of change should tell you everything, put it side by side. Here's what you had in 2025. Here's what they're offering in 2026, and give you that. So make sure if you haven't received that, you look in the mailbox or the pile of junk mail. It's a letter that they are required to send on an annual basis. And if you're here, you probably got invited to this if you're here because you were invited to this workshop, you probably got an email from me too that end of September, beginning of October, saying all this stuff. Premium changes. I'm just kind of flip through a couple of things that are more relevant. No, that's the right one. So I kind of hit on a lot of these things. So this is all the stuff that's the annual notice of change. They're going to talk about what's changed, any kind of network changes, any type of service area reductions, prescription drug changes. Things that they might be excluding that they weren't in years past. So, all the different stuff where they're not talking about what they're going to have to say to tell you previously you had this for dental and now you have this for dental insurance. Uh, um, I have a warning for you guys and along with you know, your friends, your family in the area. I'd look out for going online and putting your zip code in and talking to whoever calls you on the phone. I'd be careful about calling 1-800 numbers on the TV. I kind of joke about this that there's Medicare sharks out there. There's people who, um, and I'll digress a tiny bit. I was at one of the most depressing sales meetings I've ever been at last month. Each year, all the insurance companies they pick a day where each of them take an hour to present their plans for the year. So I'm in a room with there's probably almost 100 people in that room hearing what these insurance companies had to say. And basically what they were doing was they were essentially saying they don't want our, it was depressing because they were telling us they don't want our business. They've been losing a lot of money, and the fact that the largest insurer took their plan off the market, all these other companies have been putting up roadblocks to try and get us to represent them. Some of them are requiring you to not use a broker, or they're allowing you to use a broker but not paying the brokers anymore. So expecting us to do pro bono work. And how do I say this delicately? And they all have their reasons, and rightfully so. I mean, they're working for their stockholders, and if the stock is down so much because they're losing so much money on this, um, also companies like Tufts, that are nonprofits, they're nervous about going out of business. They're saying if all these plans are non-profitable because they have to give these benefits, and you know 200,000 people in the state get dumped from their plan, if they all go to one plan because that's what the brokers are doing, it might not be the right plan for the person. But if it's what the people are doing to still earn a living doing this, it just makes me nervous for what's going to happen. So, my offer to everybody already doing business with me is, if your plan is one that is the best plan for you, if I can't do that enrollment for you, I'll send you to their 1-800 number, or send you to medicare.gov to do your enrollment. Okay. Being a financial planner is my main profession. This isn't, I mean, this is revenue for me, but it's really more of a value added I'm doing for my financial planning clients. So I'm not going to go out of business if I'm doing the right thing for people. So this is again my warning. Look out for calling a 1-800 number, and they're going to put you on whatever plan that's making them money. All right. I'd much rather have your people come to me, and if I can help them, spend 15, 20 minutes with them and say, call this 1-800 number to sign up for the correct plan for you. That's my promise to you, all right, as a fiduciary financial planner. All right. So that's my little soapbox. And if anyone wants to have a 10-minute conversation about what's going on with the politics and whose fault this is and stuff like that, let's not do it on a group setting. But really, both sides are to blame, in my opinion, as far as what's going on. And I would say, if you don't like the choices in this direction going, best advice I can give you is call your congressman, because I don't see this being talked about enough on the news, where I'm seeing the negative impact to the beneficiary of these plans. I can look at it from my point of view, where it's hurting my business, but um, it's really difficult when I'm looking at somebody in New Hampshire and I'm looking at the list of plans available and there's nothing available. And then all of a sudden, if there's nothing available and they have to answer medical questions to get on a supplement, that person has been hurt by these rules that have been coming into place. All right, so I'm not sure if this is, so I'm Gen X, and I know you're boomers. So if you know what a QR code is, if you hold your phone up to your screen with your camera on, you can book a Medicare consultation with me. Okay. And then if you already are a client of mine and you want to just shoot me an email, my intake form is something I worked pretty hard to make it as user-friendly as possible. So if you do that on your phone, hold your phone up to the intake form. It'll walk you through what's your name, what's your email address, what's your list of doctors, what's your list of drugs, and that'll all come to my computer. I'll put them into my platform. I'll run it through, try and figure out what the right plan for you is, and then we can book a half-hour call. So either direction. Start with a consultation, then do the intake form. Or if you want to send me an intake form and shoot me an email, say, "Hey Scott, I sent you the intake form. Are you available next week?" That's what we'll do. Okay. Um, Open enrollment period goes from October 15th through December 7th. I've already got warnings from a couple of the plans I'm gravitating towards, that they may not keep their plans open. Some plans, luckily, are allowing online enrollments and allowing brokers like myself to represent them. And I've actually noticed two of them that are ones I'm proud to represent. All right. They have both warned me that they have a number in the back of their mind that once their enrollments hit that number, they have to stop their losses. All right. So they're willing to take a little bit of the risk, but they can't accept all 200,000 people being dumped onto the market. All right. So that's why I've already had 20 appointments this week. I've got 5 more this afternoon after this. And I'm just going to be trying to see as many people as possible between now and until I'm through my list. I've got 100 people in my book who are losing their insurance. So I'm really focusing my all my efforts over the next few weeks to try to get in touch with those people. So if you've gotten that letter that you're losing your plan and you haven't clicked on one of those links on the emails I've been sending, please do it ASAP. Book it for next week, and I'll do my best to try and see as many people as I possibly can. All right.